The iliopsoas muscle is of utmost importance to postural correction. A properly functioning iliopsoas promotes efficiency in movements at the level of the spine, the hip, and the leg. Chronic iliopsoas tightness may be a primary reason for postural asymmetry, or postural asymmetry may be the reason for a tight psoas. They work together. So consider the effect that the iliopsoas has on postural alignment. Number 1, when the psoas is contracted, it causes trunk flexion. The whole purpose of the CPC protocol, the complete postural correction, is for postural alignment to reverse flexure posture. So having a tight iliopsoas promotes trunk flexion, negating the holding pattern of a postural correction. So if you want your patients to hold their postural correction longer, you need to make sure that there's no tightness of that iliopsoas. Number 2, the iliopsoas is shortened in anterior pelvic tilt, meaning that it increases the lumbar lordosis. An increased lordosis creates increased stress to the spinal discs of the lumbar spine, which will degenerate with increased load, stress, and time as variables. And number 3, long-term correction of pelvic unleveling is difficult to achieve with iliopsoas tightness. Asymmetric iliopsoas strain can increase pelvic unleveling and lumbar strain. So as the pelvis is the base of the spine, chronic asymmetric postural patterns of the pelvis will lead to sustained compensation patterns, including scoliosis in the most severe and prolonged cases. When analyzing your patients, be sure to evaluate for tightness of the iliopsoas muscles. As a posture expert, you can address this concern during the CPC protocol and with postural rehabilitation to be performed by the patient outside of the office.